In our clinical practice, we prescribe ACE inhibitors or ARBs. Those are collectively called RAS blockers in patients with chronic kidney disease to slow down the progression of chronic kidney disease. Obviously, it has been shown beneficial in patients with proteinuric CKD, but if patient does not have proteinuria, heavy proteinuria, in those groups of patients also these RAS blockers are beneficial. This was recommended by KDIGO to use these RAS blockers. But recently, 5 months ago, one randomized control trial was published in NEJM. The trial was named STOP ACEi TRIAL, and what they found that whether you stop these RAS blockers or continue those RAS blockers, there was no significant difference in terms of decline in GFR at 3-year follow-up. In this study, there was 2 arms. In one arm, those participants continued those RAS blockers, and in other arms they discontinued those groups of drugs, and they followed it for 3-year duration, and they assessed the primary outcome and secondary outcome, and the primary outcome was decline in GFR, and in this graph you can see there is no statistically significant difference in decline in GFR in the 2 groups. Similarly, the need of renal replacement therapy, there is no difference in need of renal replacement therapy in between these 2 arms. So whether you discontinue those RAS blockers or continue, there is not much statistically significant difference in terms of decline in GFR, and also in terms of adverse effects and cardiovascular mortality, there is not much difference. In this study, there were few patients with proteinuria, so this finding cannot be generalized to those groups of patients with heavy proteinuria, and uncontrolled hypertension were also not included in this study. So we cannot generalize the result to those groups of patients. These are the limitations of this study. Thank you.